Welcome to our podcast today. I'm Megan Kilkeary. I'm a pharmacist with the Compounding Center in Leesburg, and I'm excited to bring on Jim Paoletti, who is a functional medicine pharmacist, and he's going to speak to us today about GI health and thyroid health in men, which I think is often a under-discussed topic, but it's an extremely important thing to address. And as a functional medicine pharmacist, Jim, tell us a little bit about your background. And then we'll get into why this is so important to men in terms of testosterone production and adrenal health and how their gut and thyroid all plays a role into this.
Thank you, Megan. Glad to be here. Yeah, I started out as a consultant for compounding and started my hormone education that way. Ended up putting on educational programs on bioidentical hormones, endocrinology, et cetera, and did the same thing for ZRT labs for years, and then got on the faculty of functional medicine and got to take their classes there. So I've been blessed to be around a lot of really, really smart people for a number of years. And now I'm going to take what I've learned and help patients with that.
Yeah, it's wonderful. And you do such a great job at that, and you are an invaluable resource to us at the Compounding Center. You just have such a wealth of knowledge when it comes to dealing with these patients. So we did some other podcasts as far as men's health goes, and we talked about adrenal function. We talked about testosterone and low T in men. Now we're going to talk a little bit about GI health and thyroid and how that plays a role into everything. I think initially when you talk about gut health, you think about, am I going to the bathroom? Am I constipated? Am I having diarrhea? Obviously, those are, important issues to address in people, but, there's a huge hormone component too to gut health and how that plays a role into everything. So talk to me a little bit about when you're assessing a patient, why it's important to ask these questions and what role that plays in men.
Well, gut health is important primarily because there is a strong connection between gut and brain. Mm-hmm. And in functional medicine, we're taught if you have a complex patient, you always start and fix the gut first. First thing you do in every patient. So we want to look at the gut health and make sure that everything's in place there, optimally functioning, so that it's not causing symptoms that we think are due to a hormone deficiency. In other words, if your gut health is out of whack, you may not produce neurotransmitters correctly, and they're out of balance, and we're going to see mood issues and depression and sleep disturbances, anxiety. You want to get the source of the problem. And gut problems are common. Mm-hmm. So it's something it's just part of the process of addressing it. The gut health affects the endocrine system. So if you're going to fix the endocrine system, you got to make sure the gut's in good health.
Right. And a lot of those symptoms of poor gut health that you talked about are also symptoms of low testosterone. So, obviously you need to figure out what's going on here. Is it a gut component? And they're obviously also all tied in together. And to your point, that's what functional medicine is all about, is tying all these systems in together and addressing each one of them so that they can all work harmoniously together. So what are some supplements that you like to recommend as far as gut health is concerned and to get patients back on the right track again?
Well, how I fix the gut with supplements is primarily depends upon the cause. So let's talk about what causes poor mm-hmm. gut health. Probably the number one factor is inflammation. So what causes inflammation? An autoimmune reaction, too much cortisol, the sad American diet, mm-hmm. a pro-inflammatory diet, major contributor to poor gut health over time. And then anything that upsets the natural flora. Toxins in our environment, antibiotic treatment, et cetera. So I'm going to look at those possible causes and say, what's going on in this person? I'm going to probably, if I have systemic symptoms of inflammation, like maybe high blood pressure, aches and pains all over, I'm going to look at what's causing this inflammation.
Mm-hmm.
I'm gonna look, do you have an autoimmune reaction going on? What's your diet, etc., and try to clear those up. I'm gonna look at cortisol because high cortisol causes gut inflammation.
Mm-hmm.
Then I'm gonna, whether I supplement or not, depends on whether you have developed what I think is leaky gut.
Mm-hmm.
Leaky gut is where you have very tiny, minute channels where you absorb food when it's totally 100% digested. When you have inflammation that causes leaky gut, those channels widen, and now you can absorb food that's not totally digested, and you can develop sensitivities and autoimmune reactions to that. So
Mm-hmm.
if I have to heal a leaky gut, it's a step further than just fixing a poor GI health, normal flora. Commonly, what you do is a probiotic.
Mm-hmm.
Now, depending upon the severity of the patient's symptoms, you have different strengths of probiotics. Probiotics, it's not just the billions or millions of units. It's most importantly, how many strains are in there?
Right.
If you have a real gut issue, I'm going to use a product that has 16 strains of lactobacillus and bacillia bacteria and a prebiotic, which
Mm-hmm.
feeds probiotics. I'm going to use a strong one, at least starting out. If you're just coming in and you have maybe some mild digestive problems and gas, I'm going to look at, do you need digestive enzymes?
Mm-hmm.
Let's talk about those for a second. So how many patients are on some kind of a protein pump inhibitor or some acid reducer? Lots.
Lots.
Right. Okay, let's look at human physiology. As we grow older, we produce less and less stomach acid over time. So if all of us are producing less acid, how come so many of us need something to suppress it even further? It
Right.
makes no sense. The problem usually is this. We also produce less digestive enzymes. So we don't digest our food quite as well. It sits in our stomach longer. The acid we do produce pools, which causes the heartburn and reflux.
Mm-hmm.
It's not a symptom of low acid, it's a symptom of poor digestion. Many of these patients just need digestive enzymes.
Exactly. Yeah.
Okay,
It's funny. I like to remind people that over in Europe, proton pump inhibitors are basically illegal. They use lots of betaine and pepsin and digestive enzymes over there to help
yeah,
patients versus these prescription or what are now over the counter here in the United States. And I just beg people, please do not use those. We've got so many other better options, for supplementation, to help you feel better.
yeah. And what people don't realize is if you look at all those acid blockers, they're all meant to be used no longer than 90 days.
Right.
They're temporary, and they are going to decrease absorption of some very important nutrients. So your system's not going to function correctly. Your stomach may feel better, but less heartburn. But overall, it's negative to your health. So
Right.
I would typically reestablish a normal flora on a probiotic, and how long they're on that depends upon their individual case. And I'm going to supply them with digestive enzymes, and then you may have patients that also need the betaine along with the digestive enzymes, which is a source of hydrochloric acid.
Mm-hmm.
And you get the proper amount of hydrochloric acid, digestive enzymes, all of a sudden they're not having those issues with digestion and flatulence and heartburn and reflux. So that's the key to it. Now, if it's more severe and they're possibly leaky gut, I want to heal that gut as quickly as possible. And a good example is if somebody has an autoimmune reaction triggered by, say, gluten sensitivity. If they're off gluten completely, that's the only thing they're reacting to, the gut will heal in 6 months. Well, that's a long time.
Mm-hmm.
You might develop more food sensitivities in the meantime, or what's the chance of going 6 months completely 100% gluten-free? Slim.
Mm-hmm.
Even if you're trying your hardest, it happens. I know I'm supposed to be gluten-free. It happens. So what I do is try to speed up the healing. I use glutamine powder, deglycinated licorice. Aloe vera juice is wonderful for healing the gut. We have a little bit of aloe vera juice in our refrigerator at home all the time.
Mm-hmm.
Okay, it's downstairs refrigerator, but it's there if we need it because it is so good for stomach upset. Aloe vera has amazing healing properties, but it'll speed up the healing of the gut lining. And of course, I'm going to put those people on one of the stronger probiotics.
Sure.
Usually use a combination of that. Deglycinated licorice I like. It doesn't taste really well, and a lot of patients don't like the taste. So usually I use a glutamine and aloe vera juice combination to speed up the gut healing.
I know you also like to do food sensitivity panels on some of your patients. Can you talk a little bit about that for a few moments?
Yeah, this is becoming an epidemic. I listened to a presentation last year from a functional medicine doctor on different functional medicine testing, which to do when. And somebody asked her at the end, which testing do you use the most? She said, oh, it used to be ZRT, saliva testing for hormones. That was by far the most. She says, but the past 18 months, it's food sensitivity.
Mm-hmm.
And she uses US Biotech, the same company we use. So I was happy with that. She says, it's becoming an epidemic. And this is what I think. I see more and more autoimmune issues, something I'm treating regularly now.
Mm-hmm.
And I'll tell you what, in all my years of helping people, I don't think there's anything that I've helped more people more significantly than identifying a food triggered autoimmune response and stopping it, stopping the progression of the disease state. And we're talking anything from Parkinson's to MS to Crohn's to Sjögren's to diabetes to rheumatoid arthritis. It's not just the gut issues, irritable bowel and other gut issues. It's all over the body, these autoimmune reactions. Hashimoto's. The chief cause of Hashimoto's is a gluten and or dairy sensitivity. And we just treat the symptoms.
Yeah.
You need to identify what's triggering the disease state. And if you can identify an autoimmune trigger, I can help you stop your disease progression at that point. So food sensitivity testing is really big.
It really kind of hammers home the idea that food is medicine, and we can really, you can really utilize food and by using these food sensitivity testings and changing diet around, how you can really heal people and really just change their lives. It's amazing.
It is
For sure. So onto thyroid a little bit. I know we've mentioned it a couple times in here. So thyroid in males. It's you and I were discussing Hashimoto's a little bit before we started recording here, and I was saying how we normally think when you think thyroid dysfunction, primarily we think females, and you said, oh no, males just as much. So I'm at fault just as much as probably any general practitioner out here in discounting how important thyroid really is in males. So talk to me a little bit about that.
Well, I'll say it's not as much as females. The prevalence isn't as high, but it's still significantly important in men. First of all, symptoms of low thyroid overlap with symptoms of low testosterone a lot. So, I'm driving home one day from work and I'm listening to a sports channel and commercials for low T clinic. And they talk about fixing this guy. I said, you didn't mention thyroid, cortisol, or insulin. How are you going to fix this guy? You've got to look at the other hormones that affect testosterone, and thyroid's a big one. Unfortunately, I don't think we do a very good job of evaluating thyroid. We do very limited testing, and there's problems with the TSH range, and it's not a great screening tool. And they're just looking at T4 and not concerned with the conversion to T3. They're not looking at the factors that affect the T3 working, like ferritin and vitamin D. And my chief complaint about thyroid is the number one cause of thyroid disorders in the United States is an autoimmune reaction. And I don't see anybody checking the antibodies. That's the number one cause. If I could only run one thyroid test by law, and you came to me with symptoms of low thyroid function or high, the first test I'm going to run is not TSH. It's going to be an antibody because that's the number one cause. First of all, TSH is just a screening tool. It's a test that was designed, says if it's out of the normal range, which the normal range goes way too high, according to the endocrine experts. But if it's out of range, it says do further testing. Well, I've got a patient sitting in front of me with a list of 12 symptoms. Do I need to screen this patient for low thyroid? No, the patient's symptoms are the very best screening test. Just go ahead and do adequate testing. So I take a functional approach. I ask, what are the causes of these symptoms, possible causes, and then what test do I need to run to determine if this is going on in this patient? And if we do it properly, you can find what's causing the symptoms much better than we've done conventionally.
Do you find that in terms of treating issues with thyroid, do most people need to go on thyroid medication for that? Or
oh no, just the opposite. Just the opposite. Yeah. There's only one type of person that needs thyroid medication: those who cannot produce enough. And I'm sorry, our thyroid production goes down very slowly, and nobody under 50 should be making an abnormal amount. If they are, first of all, if you look at their total T4, you say, is it optimal? If it's not, you say, why? You always ask this question with thyroid. If they're not converting T4 to T3, you say, why?
Mm-hmm.
If they're not getting the responsive receptor, you say, why? And then you look at the possible causes and you fix those. If they're low in production, they may just be low in iodine and or tyrosine, what you need to make T4. So the first thing you do is try to get them to make their own. Or maybe they got high cortisol, which is suppressing TSH. That's why we're always looking at cortisol at the same time. If they got high cortisol, that's causing a thyroid issue. So fix the cortisol.
Mm-hmm.
Okay, if they're not converting T4 to T3 adequately, there's a list in Dr. Brownstein's book, Overcoming Thyroid Disorders, of 32 different possible causes. But the most common ones: high cortisol, low selenium, low vitamins. So you can nutritionally fix that conversion and get to high cortisol. We always go back to cortisol. It's always messing up everything.
Mm-hmm.
But yeah, I take a functional approach to thyroid. I love working with thyroid patients. I think number one, there's so much problems out there. So many people have thyroid symptoms and they've been told your levels are normal. That's rampant. Number two, there's so much opportunity to fix them. There's so many little things that go wrong in the thyroid metabolism and utilization of that hormone that we can address. That I love working with thyroid patients because I get enthusiastic about getting them to feel better.
Yeah. And like we've talked about before, everything is just connected in: thyroid, cortisol, hormones, everything. And yet you have to, address each piece of the puzzle, or else you're not going to find that harmony, that balance.
Harmony. That's a good word. Good way to describe it. We want hormone harmony.
That's right. That's right. Jim, thanks so much for talking with me today. We're going to go ahead and put some information on how to reach out to you and contact us, for anyone who's listening that has additional questions or is interested in doing a consultation with you. So again, as always, thanks for speaking with me, and I look forward to talking with you again soon.
Thank you. You're very welcome. I enjoyed this.
Take care.
Bye-bye.